Good afternoon, and welcome to week 4, which is themed Relational on the Impact Festival 2020. Over 5 weeks, the Centre of Homelessness Impact and their partners are creating a space to meet, explore ideas, learn new skills, and build a shared sense of what we want to achieve in homelessness over these coming months and years. The theme for this year's festival is Accelerating Impact, a particularly pressing theme when huge changes and strides have been made in 2020 in response to the coronavirus pandemic still sweeping the globe. This session, titled Families Experiencing Homelessness, Removing the Barriers to Health, Social Care and Education. My name is Sam Pratt. I'm the Engagement and Communications Officer for the Shared Health Foundation, and joining me today is Beth Knowles, who's our strategic lead for Homeless Family Project, focusing on policy and advocacy. Beth has been a local councillor for a term in Manchester City Centre and the mayoral advisor for Andy Burnham's Rough Sleeping and Homelessness team. Angie Watara, who's been a midwife for 20 years and works as a focused care worker with our Homeless Families Project up in Oldham. Hopefully, Georgina Neal, if she can hear us, we've had some technical problems with us as we were logging on this afternoon, but Georgina is the Senior Housing Needs Officer for Oldham and works with the Shared Health Foundation with temporary accommodation. And also Lawrence Guinness, the CEO of the Childhood Trust. His organisation has written Children in Lockdown, a paper featuring the experiences of children in London boroughs living in poverty with a focus on families experiencing homelessness. And I'll introduce our panelists as we go on to talk about their skills and experiences. On normal days, we would usually have our lived experience officer, Nadia, with us. However, due to the furlough scheme, she can't obviously be with us to talk about her experience, but the case studies that we will share today are similar to what our team have experienced. We welcome any questions and comments, so do feel free to introduce yourself to us and other attendees in the comment box in the chat. And for any questions that come up as the session goes on, please post them in the Q&A box at the bottom centre of your screen, and I'll put that to the panellists as we go on. Everyone's going to have a chance to introduce themselves and their work, and then we'll go on to questions after that. The hashtag for the festival is CHIFest 2020, so please get involved in the conversation there too. So I'll start us off. The Shared Health Foundation, we are a community interest company whose main aim is to reduce the impact of poverty on people's health in Greater Manchester. We work specifically in areas of deprivation where the inverse care law applies the greatest. The poorer the area, the greater the health needs are. A place with higher need but with reduced resources. We pilot projects to the need that we see on the ground. Because we're funded and we work independently, and we can take risks on new projects and try new things out. We also work closely with primary care teams, meeting the need that traditional healthcare doesn't usually cover. We're clinically led with a team with a paediatrician, an A&E doctor, a nutritionist, a psychologist, and a team of project workers. We're not just a bunch of angry activists slightly enraged at the state of the world, but because we're evidence-based and clinically led. Shared Health is various different projects, which includes mental health for young people, health literacy for parents and carers, training GPs in deprivation and so on. But the main topic of today is for families that are experiencing homelessness, specifically in Greater Manchester because that's where we're based, but we've also brought in the Childhood Trust who can speak for other areas of the country. We've been working with families going through the homeless system for a couple of years and working with them across health, social and educational sectors to really unpick the problem and provide solutions. To start off with, a couple of years ago, we provided alternative school provision, food parcels, health and wellbeing support, but that really only goes so far. And the analogy of somebody gets pushed into a river, you can't just help them out again and again, but you have to find out why they're getting pushed in and work to stop that completely. The more that we've worked with the families, local authorities and other third sector organisations, we found out that there was a wider issue with safeguarding and standards within the B&Bs, as well as temporary accommodation. The families had little access to healthcare and education, with children losing an average of 55 days in school when made homeless. We wrote a report on our findings in October 2019, which you can see in the link of them in the chat that I've posted. Over COVID, we've been working with other third sector organisations to provide practical support on the ground, and our role has developed into policy and advocacy with local authorities and the Health and Social Care Partnership. The issues that families face are not new, definitely not new because of COVID. They've just been exacerbated because of it. The phrase hidden homeless is often used when describing families going through these experiences, because when they're put into B&Bs and temporary accommodation, they usually get put across borough boundaries and therefore have to reapply to schools, doctors, local authorities, etc. Thus making them hidden to the system. And because of COVID, they've essentially become invisible due to the lack of healthcare and support workers being able to visit them. But we must say at this point that we're talking about standards and safeguarding in B&Bs, that not all B&Bs are places of concern, and B&B standards are not the one and only issue that we're talking about here. It's the whole journey of homelessness. It's the whole journey through the system. One company that we know of that runs a few B&Bs for the council in Greater Manchester, they go above and beyond of what the council requires of them, with providing breakfast each morning and cleaning clothes and caring for each family as they go through this incredibly traumatic experience. During the main lockdown, we approached the Health and Social Care Partnership and other local authorities in Greater Manchester and Andy Burnham's homelessness team with 4 straightforward asks. And these are things that we found out on the ground by working with the families. Children living in B&B should get the same health and educational rights as looked after children. They should receive priority access to the NHS. Safeguarding training should be increased across the board for B&B staff. And the mixing of single homeless people and homeless families should be ended immediately. We found that this is a major safeguarding concern across the whole county, and I'm sure across the rest of the country as well. But it's not all doom and gloom. Thankfully, the local authorities in our county have moved a significant amount of families out of the B&Bs into temporary accommodation. Capacity is at an all-time low, so the challenge now is to act quickly to change the system to make it safer and more compassionate for those involved. The changes we've asked on a GM level, on the whole, have been welcomed and have been started to be actioned by the Health and Social Care Partnership. So we're not here to name or blame or shout, anything at anyone. Change only happens when we all work together. And we can all agree that the safety of these families should be all of our highest priority. It's not just those in power's responsibility, it's all of our responsibility as those working with primary and social care in the third sector and in local authorities. The numbers show that there are more families living in B&Bs and temporary accommodation than there are people sleeping rough on our streets. So with that in mind, there shouldn't there be twice as much support, twice as much coverage in the media, and twice as much public outrage as there is for street homelessness. There's lots to unpick here. So I'm going to invite Beth, who's our policy and advocacy lead, to give us a bit of insight onto her work. So Beth, take it away.
Thanks, Sam. It feels really bizarre just to talk at people, so I'm really looking forward to the discussion kind of after we've all introduced our work. So I'll try and keep what I'm saying really, really tight, and yeah, just look forward to having more of an open chat with people later on. Yeah, as Sam alluded to, the reason for us having this panel was because there's a lack of discussion around homeless families, especially compared to street homelessness and rough sleeping. And that was very much my experience in the Mayor's office. So I worked on Andy Burnham's commitment to end rough sleeping by 2020, which I'm sure most of you heard about and possibly were involved in. But it was my job to work with the community, the homelessness sector, people who have been and were homeless locally, faith sector, everybody who wasn't the public sector, to kind of galvanise us around that campaign and to get people involved. So I know it can be done. Around a specific issue, if you highlight a specific issue and get everybody involved in the solutions, because we know what they are and we know what works. That's not necessarily the discussion that needs to be had. It's the lack of will and lack of political engagement and commitment that needs to be resolved, as well as the involvement of families and children in the discussion, which is almost entirely absent currently. And that's, of course, difficult population to engage in Zooms for many reasons and to be able to meet face to face, but just because it's difficult doesn't, and especially at the moment, doesn't mean you shouldn't try. And the policy and the ideas and the different services that you develop as a result will be much stronger and last much longer as long as you have that involvement. So that's really kind of the reason behind our call to action, was to be able to galvanize political will and to gather support around very specific, I guess, ideas, I suppose, is what they are, and asks, they're not demands, of both local authorities and national government and the NHS and health and social care partnership, as Sam said. So what we know we really need and we would really like is local action to be taken, which hopefully, if Georgina's technical issues get resolved, you can hear a little bit more about that. But if not, Angie will talk to you more about what's happening in Oldham and happening in Salford. Direct action locally and making a difference, not just talking about it, getting to know individual families, understanding why they're in the situation they're in, and then being able to work out solutions a lot more effectively. And then nationally, being able to lobby for the right policy change with the right voices included. So we're hoping to set up an all-party parliamentary group with Just Life, who work with single people in temporary accommodation or unsupported temporary accommodation specifically. Some of the issues around standards and hidden homelessness are exactly the same for both of us. So we'd be great in the discussion if anybody has experience of that and has anything they want to share with us or would like to be involved in that as well. What we really need from this and what we're asked for constantly as well is to hear more about this and to have a stronger base of support and some collaborative working amongst us as well, because that's the criticism that we level at the system often, is that these families are in this situation because they've fallen through gaps, because the system doesn't work collaboratively when we need to as well. So yeah, I guess that's probably it for an introduction. I think that's me speaking for long enough. Sam, I don't know if you want to introduce Angie after
that. Thanks, Beth. We're just going to go and chat to Lawrence for a bit from the Childhood Trust down in London, because this is not just a Greater Manchester specific problem. This is nationwide. We are GM based, but we want to hear a bit more what's going on in the rest of the country. Lawrence, can you just give us a intro? Who's the Childhood Trust, what the kind of work you've been doing, and how you've been working and advocating for these families?
Yeah, absolutely. Good afternoon, Sam. Hello, everyone. I'm Lawrence Guinness, Chief Executive of the Childhood Trust. Childhood Trust is London's child poverty charity. Our sole mission in life is to alleviate the impact of child poverty in the capital. And that's a significant problem. We've got some 700,000 children living in relative poverty. We've got some, at any given time, between 85 and 90,000 families living in temporary accommodation. There's over 1 million people on the waiting list for affordable housing, social housing. And the current pandemic has highlighted the inequalities that families face and the stark inequalities of those who have and those that don't have. So our primary work is making grants, is raising funds and making and funding the delivery of projects that help to alleviate the impact of poverty all over the capital. Our secondary work is really raising awareness of child poverty, giving voice to children, giving voice to families, and really understanding and uncovering and highlighting the hidden issues that children face, that their families face in the capital, so that people, we can do something about it, and that we can be more effective in getting those unmet needs met and ensuring children can have a bright future. So the pandemic really exposed a whole number of differences in those at the very bottom of society. We normally, in the normal course of a year, we run a Christmas campaign that last year raised over 2.2 million. And we were getting ready to run our summer campaign. Clearly, when the pandemic hit in March and lockdown started, we had to revise our plans dramatically. And we leapt into action and did some very early research that was widely reported into the needs that that might arise. And that showed predominantly that a lot of the small organizations that supported children were facing an existential crisis without extra funding, and that food poverty would be a significant issue without extra support. So we created a campaign called Champions for Children. As part of that campaign, we did a lot more research. I personally interviewed about a dozen families. The campaign raised 3.66 million, raised a lot of money to fund the delivery of 94 projects. But what the campaign also did, which was really vital and as important as the money, was to help us to understand the plight of those families who, particularly those who are in temporary accommodation and who are homeless. So we uncovered very high incidences of physical and emotional abuse. We know that alcohol sales, for instance, rose by 21% during the lockdown period. Some half of all domestic violence incidents involve alcohol, up to half of all domestic violence incidents involve alcohol. A lot of children and parents were very honest in saying, look, we our living conditions are so awful, we have nowhere to go, we're all in one room. Drinking helps us to get over this. But then some of them say, well, it did for a bit and then it didn't. When I realized, one mother said, when I realized the effect that was having on my relationship with my children, I stopped drinking. And she said, I never used to drink. She said, I took to drinking because of lockdown, because of the stress, the anxiety, the pressure. So the mental health concerns of children that are isolated. I spoke to a child living in a B&B. It was temporary accommodation. Well, you couldn't really call it a bed and breakfast. Often the lines are blurred. And the child told me how lonely they felt, how they missed their peers, how they were worried about the virus killing them, killing their family. And this was a common theme that many, many, many children, nearly all the children we spoke to, expressed very deep concerns, irrational, disproportionate fears about the virus having, taking away their loved ones, taking away their own lives. And we documented all of this in a film that we made. The lack of places to play. I don't know about anywhere else in the country, but playgrounds here were decommissioned. They were all shut, couldn't get into them. So children living in one room, 4, 5 people in a room, were forced really to just walk the streets to get any kind of space. For those kids, better off kids who have gardens, not a problem at all. And not as big as a problem. But for the kids that we support, it was very clear that the inequality in terms of not having anywhere to play, not having access to play, not having any space to play, really became very apparent and very stark. And then lastly, the other big thing, and this has been widely reported, but I think the full extent of it hasn't really come to light yet, is the educational learning loss. The kind of what we call the digital divide, digital apartheid. Kids who just have no access to the internet, no access to technology, were sort of let down completely. No thought was given, and a lot of schools went bent over backwards, desperate to try and remedy that. Some were more successful than others. There's still children to this day that don't have laptops, don't have any means of getting online and doing any meaningful work or any meaningful study. A lot of kids relied on packs, having to go to the school, pick up pieces of paper. But then, that could only go so far without proper support. So our report, Children in Lockdown, was widely covered. It helped us to communicate to a much wider audience, as well as the voices of the children and the voices of the parents. So we filmed at a school in Rotherhithe. We filmed that had children of key workers there. Many of those children actually, when we say key workers, a lot of them were on very, very low wages, single parents. So again, these are parents who are fortunate enough to have jobs and are working, but also unable to break free because of the cost of rent. We've met many parents living in temporary accommodation so-called temporary accommodation, have been in this accommodation for years, that haven't been able to save up enough to break free of that. They're trapped. People living in one room. A mother in Camden springs to mind, who I met, told me she was paying £360 a week. Housing benefit was made up less than a third of that. She was having to pay the rest herself. She was on minimum wage and could never save up enough to get out of the one room, even though she was earning, a reasonable salary. So these are the conditions in London. The voices of the children, the experiences of parents, distilling that together in video. We made some illustrations. We had some illustrators that turned some of the interviews we did into incredible illustrations. They're on our website if you want to see that. Those were very powerful. And the report that we did all helped to generate the resources that children need to be, to recover from this over the next 12 months. And that funding will help about 100,000 children, we've estimated, across the 94 organizations that we've funded. So it's really critical to hear from the grassroots, from the people who are suffering in these conditions, and to empower them to feel emboldened enough that they can speak out, that this is an injustice, that they will actually help all those in similar circumstances. And when put in those terms, we found people to be very, very, who want to be heard. They want people to understand what they're having to endure so that others, won't have to go through the same experience. So that's what we've been doing in London. And it'd be interesting to hear, some of the thoughts on that work.
Brilliant, thanks, Lawrence. That's really, really good, and great to hear all the work you're doing, and fantastic all the money that you've raised to help those organisations as well. Angie, tell us a bit about your work with on the ground with the families. Tell us about maybe kind of the problems that the families come into, maybe some of the reasons why they're made homeless in the first place. Because it's a variety of different issues that there is. Living poverty is kind of a myriad of situations, isn't it? So over to you.
Hello, hi, I'm Angie. I work as a focused care practitioner. I've also been a midwife for 20 years, so I've got a real heart for women and families, young children, and those first steps in life, I guess, that lead to the rest of our health in our adult life. So yeah, I came to be part of Shared Health's Homeless Families Project just at the beginning of lockdown, did my last midwifery shift and transferred over. And I guess what we saw on the ground for the first was practical need. What we really needed was food, was hygiene essentials, was those families that were swiftly being moved by council into accommodation where they could self-isolate, but that with it brought problems that were often related to just getting up and moving in a pandemic, which they needed to be able to do. But when you put that on top of already the complex issues that we often see families who are in that situation have already been through, so journeys through issues around addiction, around domestic violence, around fleeing from one city to another city, being placed within an area that they are safe but they don't know where anything is. And then I think, as Lawrence was saying, when you've got children in that picture who are unable then to go into the park spaces, who then are trying to be outside of a one-room property, we saw lots of issues around just that transition into the homeless situation and the accommodation that they then needed to live in as a family, but also with the pandemic and all the restrictions, so access to Wi-Fi, not being able to suddenly produce online documents that they could then fulfill the requirements to then move through that process. It sounds really simple, but there are real barriers that come when in a room full, in an accommodation where you don't have free access to Wi-Fi, you are in financial hardship, where your benefits aren't quite straight yet, where you aren't necessarily thinking in a practical or straightforward logical sense. You're dealing with your own mental health, your GP has changed, you aren't able to access your prescriptions, so you're a week late in getting your medications, you've just missed your immunisations for your child. and then you may be moved into an accommodation where you don't have a stair gate, or you don't have a Moses basket, or you don't have a car seat to transport that child. All of these really practical things that I think we've all touched on come into the stories that we're hearing time and time and time again. And those barriers, as focused care practitioners and coming into this project, they're the barriers that we're trying to help. To create relationship where we will walk with these families through into a tenancy, hopefully at the other end of homelessness. But within that, we're trying to see it as a window of opportunity to do prevention. And we often look at the family as a whole in a household mindset, which looks at being trauma informed, prevention informed, and really holistic. We don't just take the person who's made the application to housing, we take the whole household. So then we're involved with education, we're involved with ensuring that schools are aware. Had one case where pastoral leave just didn't know that child had been sofa surfing for 2 years at 13. They had no idea why that child's behaviour was about to be managed move for their behaviour. But when we went in and explained, this is the situation that this child, this 13-year-old, we're saying the future's yours, go grab it as you move into secondary school, and what are your hopes and aspirations? But they didn't even have a locked door to shut to sleep in a bed that was their own. So I think the spectrum of families that we see, it's from the very basic of I can't access photo ID to present the documents that I need in order to get a bank account, in order to buy a birth certificate, because I can't pay cash anymore because COVID has shut that opportunity, have to buy it online, but I don't have a bank card, right the way through to I've got to have an emergency operation, I don't have a choice, it's time specific, I don't know how to get from one city to another and then get home, right the way through to unfortunately the saddest cases where families we know have a parent has taken their own life in that situation in this period of time. So we have all of those lived experiences that we're trying to support and walk through, to give hope, to give some ideas around how we just logically, carefully, practically move them through to a place of stability where those children are able to take hold and thrive within their communities. So that's what we've been doing in Oldham and Salford as COVID hit, and we continue.
Brilliant, thank you. So that's just an insight into kind of the variety of issues that that our work is going to come across on the ground. So moving from kind of like specific solutions to removing those barriers on the ground to more of a local authority level. We've got Georgina Neild here from Oldham Council. Can you hear us okay? I know we had some technical issues before.
I can hear you. Can you hear me?
I can, fantastic.
Great.
Can you tell us what your role is within the council, how you're working with these families with temporary accommodation, and just give us a bit of an overview of what Oldham have done?
Certainly, yes. So, yeah, I'm Georgina Neild. I'm a Senior Housing Needs Officer at Oldham Council. What that means in my remit is I have an operational lead for providing temporary accommodation, so around our private rented sector move on and supported accommodation as well. So operationally very involved in our temporary accommodation service. I joined in February and was greeted by a very immediate short-term plan with the aim to be to decrease our B&B population for our families. When I say a short-term plan, it was a 3 to 6 month aspiration in terms of bringing other provision on board. That was expedited, obviously, on the 22nd of March with the lockdown that happened and our response. So we geared up to remove all families from B&B accommodation as quickly as possible and brought on additional provision. Our long-term aim as a local authority is to have much more leased or owned stock. At the moment, we work with providers, real good quality providers, to offer some of our accommodation. But that is our aim, to be able to have minimal families in B&B for the shortest amount of time. So as of today, we have 3 families in B&B accommodation. 2 of them are recent placements, so have been with us less than a week and have planned move-ons for this week. The third is there for a particular reason. There's a planned move back to the house at the end of February. At the end of this week, Friday, because we're waiting for a non-molestation order against the perpetrator. She's a victim of domestic violence, and she chose not to want to move twice because she's returned home. So we've really vastly reduced our numbers in B&B accommodation. Other things that we've done, we've really harnessed our relationships really with our health and social care sector. I think everybody here has got much more experience maybe than even me of knowing the importance and intrinsic link between health and housing. And that just isn't the link in terms of how one or the other affects our customers or our families, but it's also how we work together as professionals, housing and health. So that's something we've tried to keep motivated through COVID-19 with virtual multidisciplinary team meetings, so there was no families kind of falling through the net. We're also working with them on, when we talk about our easier wins or our harder goals, I'd say one of the harder things that we're seeing as a more long-term aim is the understanding that temporary accommodation isn't just always provided by the statutory housing authority. There are families that will be placed in temporary accommodation who've no recourse to public funds, for instance, by social care. So how are those families being tracked and ensuring that their needs are met? Picking up on some of the difficulties and challenges for families that are in temporary accommodation, we rarely place out of borough. We're in a really positive position to be able to place in borough, and we will actually only ever place out of borough when there's safeguarding concerns. That's another piece of work around domestic abuse. Obviously, we've got the new domestic abuse bill, and we really hope that might provide an increase in resources, because we feel that's what's needed. In terms of trends throughout lockdown, increase in family presentations due to fleeing, and another is due to kind of family placement breakdowns. So, may have been staying with her mum and dad or family member with their children, and obviously the pressure of lockdown has meant that that's broken down. We've brought in mediation work, but it isn't always successful. So there's lots of continued work, but in the short term, in the response, it's been really positive. Angie and I joined at a very similar time and had a very similar aspiration. We've got great partnerships across Greater Manchester. In talking about out of borough placements and supporting these families who may end up in areas, we have a real GM approach around our Section 208 notifications. So that's where a local authority do place in another borough. There is a legislative requirement for you to notify the accommodating borough. So if Oldham were to place in Manchester for whatever reason, even if it's safeguarding concerns, we would have to make sure that that notification was issued so that the relevant agencies or departments within the authority can work with them families. And it isn't that we've placed them there and then they become another local authority's kind of responsibility. It's that joint working. So that's something that's really positive. Very local to Oldham, but was across all the GM local authorities. We set up a hub team, so a crisis line or an emergency line where people could access food parcels and kettle packs, because obviously the closure of the food banks or the limited opening times of the food banks hit. We also worked with that same team around offering educational and activity packs. So very similar to how we work with shared health with our families, we provided that same information to our young people's team and our youth teams within the council, and they delivered packs of the appropriate educational age to the families the children of the families in temporary accommodation. So this was work that kind of happened that has really fostered relationships that we want to take forward now. Things that have been a positive out of such an extreme situation, we want to harness and continue with. So that's what we've been doing in Oldham, but very much linking in with our GM counterparts. I know there is maybe a strategic aim to look at how we procure temporary accommodation long term across Greater Manchester. Is there a Greater Manchester approach that we can take? And I think I've touched upon obviously our challenges, which was around domestic abuse presentations and those that aren't placed under ourselves, families that adult social care or children's social care have placed, and we need to ensure that they're known to the relevant agencies. So I hope that gives you a little bit of a flavour of what we've been doing both locally but linking in with Greater Manchester as well.
Brilliant. Thanks, Georgina. Let's move over to kind of influencing policy. We've had a question come in. So how did the people who are experiencing homelessness contribute to your policy development? Are there any individuals who advised over a period of time? So we've got a lived experience officer who's currently on fellow who influences her experience and kind of like how the policy that we want to see happen, that can influence that. In terms of Beth, Lawrence, or Georgina might maybe to throw in, have you got anybody in your teams, or maybe there's how do you gain that those experiences that contribute to your policy development? That goes to anyone that wants to answer it.
Yeah, I'm happy to chip in here. Obviously, it's something that I'm very passionate about, something that I've worked on in a previous role, and it was a question I asked when I actually joined Oldham 6 months ago. In terms of lived experience within our service, in the wider housing options teams we do, specifically with our outreach coordinators, we have some people with lived experience. In terms of how they inform policy, we've recently discussed that people will sometimes challenge decisions through their right to review or right to appeal. And we use that learning from review and appeals process to directly inform, our policy or review our policy or our strategic aims. So that directly feeds it. In terms of other policies, we've just reviewed our allocations policy because we've brought our service back in-house from last year, and I know that there was a working group where we did actually gather feedback from our customers about their previous that were already on the housing register that were going to see the change, and we gathered feedback through questionnaires and engagement. So it's very much present. I would say, of course, there's always more to do, but yeah, we have both engagement, learning, but also lived experience staff members within our housing options team, which I think is only of a fantastic benefit, really.
Absolutely. Lawrence, do you have anything to add on from your neck of the woods?
Well, I think what we found is that the consequences of policies are often misunderstood or not highlighted at all. And I'm talking about the human cost and the way that makes people, causes misery and causes suffering, and the difficulties that generates. And by communicating those to policymakers and to the public at large, we find that creates favourable conditions for better, more sympathetic policies. So immigration policy is done, is a good the Windrush case, for instance, is a good example of that. If you communicating the human cost in terms of narrative stories, specific cases, often leads to some degree of movement, just because often people just don't know. They didn't know. And Georgina, I was interested in the fact that you used the right to review stories to inform your policy. I wanted to ask you, are those kept private? Are those closed hearings, or are they public hearings, the information that comes from those?
So my understanding is, and it is my strategic partners that complete them, they are closed, but we can share the information because we will ask the customer if they are willing to obviously consent for that information to be shared. So I see them as an operational lead with some strategic responsibilities as case studies. Those reviews and appeals, that's how I learn how we need to kind of review how we manage our service. So very much at a strategic level, but also affecting how operationally my staff work. I think I picked up on success. We have a real stance in Oldham that there's nobody in temporary accommodation that shouldn't have a move on plan. So you talked about some of your families being stuck. Their move on plan would be very clear. I know we can talk about duplication with a personal housing plan, but this is very temporary accommodation specific, and it's the temporary accommodation officer that will drive that rather than the case officer within the homeless team. So, and obviously we may not have the same challenges you do in the London boroughs, but we certainly have those challenges. So sometimes those reviews or appeals will inform how we've managed something operationally, as well as how we're going to adopt strategically. And that's something that I'm really proud about since I've come to Oldham that I've seen is very prevalent. So yeah, we will always ask if consent can be given so we can share that information. And the learnings, what the key part is the learnings.
Yeah, it's very interesting.
Excellent, thank you very much. Beth, I've got more of a specific question for you. The joined up approach to health and housing is really crucial, and not all local authorities are able to do this. So what are your best practice tips for fostering these relationships locally?
I mean, it's just fostering relationships, isn't it? I think the first bit of the sentence is, of course it's important, but it's relationships and respect. People, isn't it? I think that's my individual top tip is treat people like people, and then just the respect and the mutual understanding that comes with just an individual relationship. I think people focus, because it's so obvious, the silos and the ineffective working in between departments. People focus too much on multidisciplinary, interdepartmental, multi-agency approaches and working. That just means human beings talking to each other, and I think it's too often forgotten. And I think, especially across Greater Manchester, when you have 10 boroughs then added into that mix, trying to work together, the scale is huge. It's nearly 3 million people involved all of a sudden. And I think, yeah, just remembering that it's on an individual level and on a local level, you can do a lot, and not everything has to be done at higher strategic levels. I think a lot between this is I actually in my part-time I'm an ethnographer and I study bureaucracy and that's one of the major points out of that, as well, is that for officers and people who are using services to try and reach a common and a mutual understanding as well, not just service to service and borough to borough, and politicians added into that mix as well. I think that relates to the co-production question as well. To start out with co-production, you have to all have an equal place around the table and be willing to listen to one another, and that's difficult enough as it is, never mind the content of what you're trying to say to one another and that being challenging. Yeah, that's probably a bit of an odd answer. Sorry.
Angie, in terms of barriers, especially in schools and education point of view, you mentioned before that there was children that you're working with that the teachers didn't even know that their families were sofa surfing. So how do teachers, schools, education, how do you get rid of that barrier so that they're aware of what's going on?
I think it's really difficult, and like Beth was saying, bring it to the individual, to the family. So we do a lot of family stories about whether they're happy to share their journey from the start to the end, and we do good news stories about where they've managed to achieve to get to, and what have been the challenges, what have been the barriers. I think there's a huge amount of shame attached to homeless families, especially if there are teenage children within that household. I think primary is a little bit easier to navigate, in a sense of early years and informing nursery, or things are a little bit tricky. At home the situation has changed, but once you add that extra layer to teenagers, I think the pastoral teams in so many of our secondary schools are amazing, but if they're not being given the information, it's really hard for them to assess that in any depth if there's not a way for them to share that information. So we try and encourage families to fill out a form which they can just hand in to the pastoral team to just give a little bit of detail to the school about the situation that the family's going through, and the transition that may be transitional, that they may not have a clean uniform, that they may not have had breakfast, that they may not have yet accessed free school meals. But those were simple things in that case that we were able to do, and the mum felt a whole weight had been lifted, and the school were able to apply those slight changes to that child's daily routine, which meant they could get a sandwich for breakfast when they first came in. It meant they could go and get their lunch, but it also meant that they could access counselling within the school in order to have a safe space where they could discuss their own mental health within that transition, within them trying to learn and attain the information that they were being taught throughout that provision. And so I think, yeah, that's one of the ways. It's about treating people as individuals with respect, understanding that it does carry a huge amount of shame, that we're not wanting to add to that. In Salford, when we initially with lockdown, we managed to launch as well as giving food parcels, hygiene essentials, and baby bank was a real thing that we saw. There was a need for, being moved suddenly into an accommodation where you don't have nappies, you don't have facilities to make a bottle of milk, where you don't have things to clean your children with, adds another level of shame to not even being able to provide those basic needs, to put your child in a clean pair of pajamas, to put to bed. So once you alleviate that, it gives them space, I think, and once those practical barriers are removed a little bit, it allows space for those other conscious decisions about what do we need to move forward in this awful situation. It builds trust within that relationship, that I actually care about where you are as a person today, presenting in crisis, and then we can move forward. So that's another way I think that we remove those barriers. It is the practical, along with, right, what's the plan for you to step out of this step by step, and we'll help you to do that, whether it's providing Wi-Fi access through our mobiles and things to apply for what you need, getting you that doctor's appointment so your mental health can be reviewed, making sure that you have access to all those universal screening that everybody else in the world accesses, and chooses to access. That's much more difficult if you're in a transient situation, which is very stressful and complex, because you're moving through the homeless system. So I think that's really important too.
And in that, how do you improve the family's emotional mental health and their resilience? Is there certain things that you do, or certain best practices that you do to do that?
I think as you listen to stories of family stories and individual hopes and aspirations, you're able to pinpoint what for them is really important for the future. And if you can help them to navigate how to get there, that brings hope. And what we all need in order to make change, sometimes when we've been through very traumatic situations, very disruptive situations, we need to believe that it can be different in the future. And I think mental health and issues around mental health are completely exacerbated by these situations of transient. Where are we going to live? Where's safe? What door do I shut? Where do I lay my head at night? Where do my children lay their head at night? That all adds to the stress of that parent. Like we were saying, like Lawrence was saying about the drinking, where do they then go to just escape? And we all know that our lives, we've not been able to escape this lockdown, and work, rest and play all roll into one. And that's a really difficult space if you're not privileged, if you don't have a garden, if you don't have a space that you can go to just let off steam. If you're in that 1-bedroom flat, we do have the angry boys, we have the self-harming teenagers, we've got the mum that's fled domestic violence, who's pregnant and doesn't know where her next meal or provision is coming from because everything is in chaos. It's all in one row in some of these stories. So it's
yeah. So there's 1,000 different ways that you can help practically on the grassroots level, especially when you're meeting families, and they can come in like in any part of their journey as well, before they're issued a Section 21 and before they're in the B&Bs or temporary accommodations. There's all that. So there's loads of great practical things, and especially what Lawrence was saying in terms of all the organisations he's been able to assist with. The bigger picture, Beth or Georgina, how do we go about just improving the system in terms of whether it's the system of going through temporary accommodation or in B&Bs? Beth has just done an exasperated sigh. Just go, where do you start? Beth, do you want to jump in? What's the thing that we can do in the next 3 months? And I say we, I mean as the kind of localities. What can we do to sort it all out?
Easy question, thanks, Sam. I mean, that's kind of the problem, isn't it? Is what can we do? Are we locally at the limits of what we're able to do? And I mean, this was hard enough before COVID, right? And the tsunami of social and economic inequalities that are coming is going to have to be dealt with above and beyond any of our pay grades, I think. And there's some political recognition around that would be a start, because the subject that we all, you know, is being skirted around in the middle, isn't it? Is that this is about poverty, and it's about class, and it's about a lack of power and a lack of ability to maneuver around a system that's working against you and oppressing you, and from multiple different angles. And I think what we can do locally is try to mitigate that as much as possible, and involve people in the services that are being designed around them. Try and, as you said, Sam, like try and offer employment opportunities to people as well. It's not just unpaid involvement in meetings, it's employment opportunities as and within local authorities and within organisations working on this. And I think that's a kind of, is a micro level, isn't it? And try and change as much as of the working practices that we need to locally, and recognising where things can improve, because sometimes there's some vulnerability to admitting that, I think, on a few different fronts, that there is a situation locally that we don't want to see, but we need to look at it. But there needs to be some more recognition nationally as well. What is going on with evictions? Like, is that the end to evictions going to stop? And what is going to happen? What's going to happen when furlough lifts? We're already working with families in this situation, and I think we need to start saying we can't deal with it all locally. It isn't just our responsibility.
Yeah.
Georgina, can you come in on that?
Yeah, so obviously it's something we're preparing for. So we've got a very experienced and knowledgeable tenancy officer. Tenancy relations officer is the role, and she's been working very actively throughout to try and minimise the amount of evictions that we're still coming through despite the current. So challenging, mediation, working with landlords. She's very close with our environmental health team, but we are, as a borough, very much preparing for what may happen at the end of September. So the two things we're doing in terms of the next 3 months, what we're planning for, you know, you asked Sam, what can we change, what can we improve? Unfortunately, I think the reality is we're actually just going to be dealing with the fallout. So rather than taking ourselves forward to improve the quality or what we need now, we need the political will, we need the legislative change. That isn't something that so much we can affect locally, but things we can do locally. We're preparing for what's going to happen with the evictions in terms of making sure we've got provision, because the last thing we want to do is to see, after all our hard work to decrease our numbers, to basically eradicate our numbers of families in B&B, because that's what we've done, to see that go back up. But it also is going to affect those that are in Serco accommodation. So those that were granted leave to remain, we would normally then assess and either accommodate or support, depending on what duty they were owed legislatively, out of their Serco accommodation in a planned way. But Serco have been holding off on the evictions as well. So we're going to have a lot of families in each of the boroughs. So I know the figures roughly, because we've been working on them in Oldham over the last couple of weeks, is about 25. If that's just one borough, how many families across Greater Manchester are we going to have that potentially may need to be accommodated? Not all of them will be owed a duty to be accommodated, but some will. So the next 3 months, unfortunately, we're not in a position to be able to say what we can improve drastically. It's about ensuring we minimise the impact of what's coming, because it's political will, it's legislative change, it's that GM-wide recognition, which I feel we've got, to pool resources and to work in a better way. Locally, what we can do, there's loads we can do. We heard examples today of people who are stuck because they can't get the money together for the first month's rent. We fund that in Oldham. If you are a family in temporary accommodation, through our bond scheme, if we find you or you find yourself a private rented sector, we will pay the first month's rent up front and secure a bond. We can do that either through a housing benefit claim where there's no repayment required, or we can do it through a spend to save where the customer can set up a payment plan. We have real good private sector links, but there's lots that needs to be done. Social housing isn't being built, it isn't there. There isn't going to be more accommodation through the social housing routes. So again, across GM, ethical lettings agencies is something that is an initiative across GM, but locally we're working on, because we need stronger and more good private rented stock, and we also need the support from our counterparts to recognise that private rented sector isn't the poor relation. It's a very viable option for many of our families. In fact, it's the only option for many of our families, but it's got to be done in a quality controlled way, which is the responsibility of the local authority. So loads to do, some of it very much within our gift, but some of it very much not.
I think we've lost Sam, haven't we?
Have I finished him off? Sorry, Sam. He only asked me how things are going to go in the next 3 months.
It's too big a question. Lawrence, did you have anything you wanted to say about that, about what we can do tangibly?
Yeah, it's, well, you know, we're less, you know, at the sharper end of policy and lobbying, but I think, you know, from our perspective, well, you know, we need to keep up the pressure in making this visible as possible, and that you know, as policies are formed, as you know, there's no question that there needs to be more houses built. We all know that, but I think it's you know, we're at a kind of, you know, always faced with this dilemma of more social housing or more private rented accommodation, and I think you know, there's a dichotomy there. It's completely two different approaches, and the, you know, there's no question we need more social housing. That as wages, you know, the vast disparity in wages, you know, people need to be able to live well on a minimum wage, and that really means that only means having not-for-profit housing that is sustainable, that can be built at a reasonable cost, that offers a minimum amount of space for families. So I think, you know, we need to always stress the consequences of, and the false economy of, putting children and families in housing that's unfit for purpose, that doesn't you know, you can't live and have a life in housing that is unfit for purpose. There are costs and consequences to everybody, and society, to the taxpayer, to all of us, when we follow these policies.
Yeah, and if we don't enable them to have that good start in life where they can thrive, then we're looking at the next generation.
Absolutely.
Childhood experiences, and they become the adults coming through that system, and that's why it's so important to have that really therapeutic relationship that goes beyond just being given the tenancy, where we make sure they're able to maintain that tenancy, because all of those other health and well-being aspects are part of the package that's being offered. I think it's ensuring that is part of it as well, so that they maintain their tenancy, but also then move forward into a productive and contributory life towards the rest of community.
Cool. Well, thanks for carrying on with that. I know it all went horribly wrong on my side. I'm not entirely sure what happened, but thank you all for joining us today, and for sharing your experiences and your advice, especially for reducing the barriers that these the families living in B&Bs and temporary accommodation have with health, social care and education. It's been absolutely fantastic for you all joining here today. You know, carry on the conversation on Twitter, on CHI Fest 2020. Find us online, sharedhealth.org.uk. Find the Childhood Trust online, and Oldham Council if you want to engage with them on Twitter as well. Our three organisations, will working incredibly hard to support and fight for and advocate for these families, because when it comes to safeguarding children and vulnerable families, that's the paramount. That's the whole reason that why we're here, and we won't stop until that is done, because we all want to do ourselves out of a job. That's what we're here for. So thanks very much for joining, for all the attendees, and we'll see you on a Zoom call near you. Thank you.
Yeah. Brilliant.
Thank you.
Thanks, everyone.
Thanks, everyone.
Bye.
Bye.